Good afternoon, dear colleagues. Let us start it. If you have some presentations, please come up here so that we could see you. Unless you come up, you will come up a little bit later. Let us start our session. I am Oganes Madoyan from Armenia, the Vice Director of the National Center of Infectious Diseases. I would like to express my gratitude to the organizers for granting me this session. I have a 20-year experience in the civil society and in public organizations, and I'm nostalgic about it. Our topic is the civil society in the era of COVID-19. I believe that it was shown that in order to combat the HIV pandemic and the COVID-19 pandemic, cooperation is of prime importance. I mean, the cooperation of public organizations and the civil society. Our speakers will share their valuable experience in this domain. Would like to change the order of the presentations. Vladimir Malinovsky had an urgent need to leave us beforehand. Thus, let me put his presentation on the first place. Yes, it is a pleasure for me, because we started calling one another by patronymic. We have been working as a public institution, and it's an amiable public institution for many years. But although I cannot call you this way, can I switch on the presentation? As for the interaction with public institutions, let me indicate of the interaction with public healthcare institutions, which can be achieved by cooperation. There is a social bridge center, which is now functioning in Moscow. Here is the history background. The Social and Information Project Bridge, which is an information center, has been working on the basis of the second infectious hospital number 2 and Moscow AIDS Center. It has been existing since 2009, and it was allocated free of charge. Our counselors, our workers, volunteers, and activists are located there. This project is being implemented under the guidance of the regional public institution of cooperation to people who are living with HIV and AIDS. Which services do we actually provide? We consult on adherence to ARVT treatment, and our priority is the following. All the counselors working in the AIDS center are living with HIV. They have the experience in this domain. They receive this ARVT treatment. Here are the examples of people who are on treatment, and these examples positively affect the motivation of other patients to start treatment. We work at the request of the customers. We make them be aware of the transmission pathway and diagnosis of the virus and the RVT treatment, and they are also referred to other social services which have been functioning in Moscow. Also, they accompany them at testing to antibodies to HIV infections. They are referred to other social services. Not only do Moscow residents, but also the guests of the capital may get access to company for HIV infection tests. We will conduct a preliminary consultation on the parity system, and then they will be in the cabinet of Moscow AIDS Center, and our infection doctor will also conduct this consultation and examination. The first kind of analysis is anonymous And then the person receives results, and if he needs a certificate, he can get them by passport. If some problems emerge, we have this people register for it. If this person doesn't live in Moscow, we show him the algorithm of treatment regimen. We also carry out social accompanying of patients with disabilities. I mean, the supply of drugs. Patients with disabilities have difficulties while going to the social institutions. It is a true challenge. They provide them the service on the supply of drugs. If they are not located at home, if they are in the healthcare institutions, we also provide them with drugs. We do not only provide them to persons with disabilities. If we get a certificate and make a medical card, the person on rehabilitation can receive the drugs because they are delivered to this person who is not at home. We issue a certificate signed by the doctor and a special informed consent to the patients. Social accompanying of patients of Moscow City Center AIDS with disabilities, accompanying to medical organizations. I mean, the persons with disabilities of the first group, they are referred to AIDS center for monitoring, for tests, in order to make them be treated, and then they are transported backwards. Another service is the following: those who refer to us, those who have problems, can be accompanied. We help others to hospitalize them. Thanks to our efforts, they communicate with doctors, and then they are referred to infectious diseases, to infectious hospitals. It may be related to persons without documents. The papers don't play any role. The number of the customers is the following: 1,383, and then this number increased. The number of consultations is 931. The number of people on drug delivery is 50. These figures do not change over years. 50 people are under our protection. We faced different financial difficulties in 2019. Still, this project is voluntary in some cases. We provide services to more people, but still 50 people are a constant number, which doesn't change. If this person dies or moves to another place, this place may be liberated. And persons in prevention institutions are the following. There are 42 people. COVID-19 is inevitable nowadays. Under the pandemic of coronavirus, the number of customers has increased. I mean, the customers who refer to social services, to the delivery of ARVT, and accompanying to medical institutions. When nothing worked in April 2020, people aged over 65 could not even use public transport free of charge. They could be fined for being at that place. They were considered by our volunteers, and still our statistics do not include these people. We can see our loyal customers here. Thanks to our volunteers and our activists, people who were indifferent, we managed to implement this program. Despite the challenges of the pandemic, we tried to satisfy all the requests. We all did it. And some doctors referred to us saying that it was crucial. It is achievable because when we deal with the bridge project, it functions under this center.
And if we talk about the second infection hospital of the second Moscow Center of AIDS and the Narcological Center, that is a state-based entity. That's the one thing. And we have the foundation of Shogo there, also Mercy Fund, Embryo Positivная Oblast. So these are those NGOs and which are with us. Clients are different, requests are different, and due to the partnership network available, we actually readdress the clients upon the profile. If we are unable to do anything ourselves, if some hospitals are needed, we dispatch them to the narcological entity. And also the overwhelming majority of work is done by the volunteers. They do the bulk of work. And also, as a follow-up to COVID-19, this is one of our organizations, the Moscow Interregional Oblast Organization. And if you do remember, there was the special presidential grant allocated for COVID-19 combating project. And we, within 6 months, managed to acquire very significant indicators to providing social service, to disseminate PPEs, to support the patients onto special hospitals and outpatient clinics, also delivery of drugs and equipment, and quite a number of people contributed onto this particular effort, and also online, thanks to the efforts of our volunteers and employees. We have the Fund for Presidential Grants in 2017, and also the Committee for the Public Connections and the Youth Policy under the Mayor of Moscow supporting us. But even though we couldn't have money at certain periods, anyway, services are provided. And we think it's our great achievement, and we never had any interruption in our activities. And so we see our whereabouts, that's the central AIDS department, and we have an extra exit, and we have a standalone block, and we are more than happy to provide assistance to everybody. And actually, if you have any questions, you are welcome. Thank you for your presentation. That is a good example of cooperation of PPP and actual NGOs and public structures are cooperating. You do not have to pay for rental fees and other fees. Dear colleagues, if you have any questions, you are welcome. I heard about volunteers, and some people have been working there for 15 years. How many volunteers are available? Maybe these are the same people who used to work with you for a number of years. Yes, indeed, we have 3 or 4 young girls. They were very highly motivated when I organized some learning activities in the university. And they said that they want to go to the hospital ward, the isolator, and it's HIV/AIDS aid they provide, and this is also a group of mutual assistance, and we have people always ready to help us. And thanks to that educational programs, we have the girls to be involved in that business and as volunteers, and 90% are those who are representatives of ours who already have HIV or AIDS, and we rendered assistance to them at a certain point of time, and now they do it on a reciprocal basis. Thank you so much. Sorry, the question cannot be heard. You organized in the course of lockdown the delivery of medications. You somehow streamlined this procedure. And how did you manage to do so? Yes, I understood your question. We, when the quarantine was administered, couldn't go anywhere. And the car was under the cameras, and you have to pay 5,000. These were my happiest days in Moscow. I'm a Moscow-born person, and was happy to get these letters penalizing me. And all the passes were issued via Gosuslugi electronically, and those who were with us got the passes absolutely without any complications. What allowed us to deliver our aid and assistance, and we normally had calls from our patients. We always had the PPEs, and we didn't give any deliveries in person. We put everything in front of the closed door, all the parcels, and actually that was how we acted. They just electronically signed the mere case of delivery, and we had those people among our patients who had the identified COVID. They had to stay at home, having not a very severe form of COVID. And we actually had to communicate with them. And it's a good thing that we had a chance to move. And the majority of NGOs, well, actually managed to do so amidst the pandemic. Any other questions? Thank you. I'm so sorry. It's force majeure. I was supposed to be the last speaker. Okay, I wish you all the best and success. I wanted you to take some of the souvenirs of ours, some condoms, some other tools that comes from the organization UH. And now the floor is given to Vereshchagin Yuliiya. Yuliiya, sorry. Good afternoon, ladies and gentlemen. I represent the patients movement, patients control, and I'm going to dwell upon my project and how we provided drugs in the course of COVID's lockdown, and specifically for the foreigners. Due to the pandemic, thousands and thousands of people happened to be at the territory of foreign countries, and among them were HIV infected. And they were supposed to get the antivirus preparation drugs, and they were supposed to get this therapy. Being locked at the territory of other countries, they have become the hostage of this situation. And actually, nobody knew how these measures have to be administered, and nobody knew how long it will all last. And people were sometimes unable to purchase any medication of that sort. And this RV drugs are not available, OTC, and the patients were unable on a free basis to acquire this specific drugs. And so jointly with the non-commercial organizations, we addressed a number of companies with a request on the charitable donations, thus providing antiviral drugs for the foreigners. held at the Church of the Russian Federation. 5 companies granted this aid to us, and this information was disseminated in the social network in some FIB groups, for example, dedicated to HIV, and they also got the information of that sort from the doctors of that patients staying in their own countries. It was all necessitated due to the fact that the prescription had to be issued for those specific drugs. And thanks to the efforts of HIV activists and the employers of international organizations, we've managed to work in that fashion while acquiring the prescription, and the monthly drug administering was provided, as well as the consultation of our physicians. In Russia, we do not have any type of combined drugs. Many patients are accustomed to that, and they had to replace some mono drugs. And thanks to the consultancy provided to that services, all of them got a detailed instruction and prescriptions as how to administer this or that drug. The project was initiated at the end of May and lasted till September, and the majority of requests arrived in May and June. Then the flow of requests somehow minimized later, but still till October we got those list of requests, and 449 people got that aid out of 19 countries, and the majority of those inquiries came from Ukraine, Moldova, Kyrgyzstan, and Armenia. And the first inquiries arrived at the very start of April, when the borders were closed, and the Patients Society and volunteers actually provided this aid at the very start, and 78 foreign-based citizens got this aid at this period of time. Those patients were disseminated all along Russia, in 35 regions of Russia, just quite a vast geography, I should say. And the majority of messages came from Moscow and St. Petersburg, Tatarstan, and the Moscow Oblast. And it's also worthy to mention how we provided the aid beyond the territory of the Russian Federation. And it was LifeMe Plus treatment, and we rendered equipment and medication to HIV positive people who were forced to stay beyond the borders of Russia. 232 people locked in 49 countries of the world managed to get this aid, and each of them were sponsored in terms of getting the therapy at the country of their location. And summing up, let me say that it was all due to our joint efforts, and we retained the health and safety of people having HIV. They managed to go on treating their disease, and it also minimized the risk of some complications and implications that of the opportunistic infections, which may occur due to the interval in the course of the treatment and the follow-up hospitalization. And I think we also contributed into the prevention of HIV, and the better contact with NGOs and other doctors were streamlined. And at the time of this painstaking period, we spared no effort as to organizing this work for the foreign-based people. And this aid just reached.
You.
регионе и даже в мире знаем, как
I believe that we have conducted great work. It is the work of the patient control, which is aimed at providing access to treatment. I personally would like to highlight that some of our patients were in Russia. They allowed us not to interrupt treatment. Many of us faced it. Thank you very much. I am very happy, thank you. I would like to express my gratitude to your team and to your workers. Maybe any questions to Yuliiya? What is happening to these patients right now? Are they on treatment? What do they face right now? People started opening borders in September, and people managed to have a chance to leave for their countries. People started opening borders in July, and there was a decline in these communications. In June, we received 150 messages, and there were 90 of them in July, and there were 40 of them, 40 flights in August. People started coming back to their countries for treatment. Some countries, such as Kyrgyzstan, managed to streamline the provision of drugs from Kyrgyzstan to Russia so that people could have a chance to save money for the flights because they became very expensive. The budget was also limited. We hope that the project would last till July because the borders had to be opened, but the measures were reinforced and we managed to prolong this project till the end of September. No one hoped that it would last for such a long time and the borders would be closed. Still, we succeeded in existing under such conditions. Thank you very much. Maybe some other questions? No questions? Dear colleagues, we also have 3 speakers. Do you have any information on them? Let us listen to one of our speakers via Zoom, and that's all. Tigran, here. We're delighted to see you. We're delighted to hear you. We're delighted to hear you. Could I talk? Are you watching the online broadcast? If you're watching the online broadcast, you can either switch it off or switch off the mic. We may start. That's great. I would like to invite Tigran Yepoyan via Zoom, the regional counselor of UNESCO on HIV and education in the domain of education in healthcare, discrimination of workers of education with HIV. Sorry for this delay, Tigran. The floor is yours. The preventive approach to discrimination, to prevention of discrimination of students with HIV. Good afternoon. Can you hear me? Yes, we can hear you. It's all right. Good afternoon, dear friends. Unfortunately, I cannot hear the presenter via Zoom. I would like to receive the feedback whether the participants hear me or not. Yes, we can hear you. It's all right. Maybe you'll send a message in the chat box. Yes. Hopefully you can hear me, and I'll keep my presentation. Thank you, the organizers of the event, for having me at this conference. It takes place in this hybrid format. I would like to join all of you in the World Trade Center. I'd like to see my acquaintances and my friends. We've just listened to interesting presentations of our colleagues about patient organizations who helped people with HIV in this challenging era when we first faced the lockdown and no one was aware of the actions they had to undertake. But the topic of my presentation is different. We have already covered this topic at the conference, at the plenary session, despite the fact that over 30 years have been after the pandemic, stigmatization and discrimination are a hurdle to people who can be tested and be treated. And overcoming the spread of HIV infection and the implications of HIV should be more effective. We have already found a lot of information on this virus. We are aware of the ways it spreads, but we are afraid of it. We have an unbiased attitude to those who are affected by this disease. Maybe you remember the American teenager who was Ryan White, who was diagnosed with HIV in 1961. And then he fought for his own rights and the rights of patients with HIV, for the opportunity to live a normal life, to study at school and to socialize with the friends. Few facts were known about this infection. Some of them did not have any access to school. Still, he received the permission, although he had to move to another town where he started going to school. His health condition got worse, and he had to work at home. Many years later, due to these irrational fears, we still doubt, we hesitate. Occasionally, we read these facts in the press. People face the following situations. Schools or kindergartens may not allow some children to study at school or at the kindergartens. They face the choice. Sometimes they are compelled to leave school. Over these years, the situation has changed. if we even review the results of the All-Russian Representative Survey conducted in 2005 and 2018, we see that the public opinion has changed. Back in 2005, more than half of the respondents believed that it would be impossible to let their children study at schools where patients with HIV studied, but the proportion of these respondents decreased twice in 2018, and the proportion of those who understand that it would be hard for them to send their children to schools with HIV patients, they would be ready to do it. This happened in 2018, and the proportion of such people increased twice. Still, they understand that that is all right. This data inspire us, and our immense work is conducted by real heroes and activists who reveal their diagnosis, who socialize with others, who participate in different press events and help the society overcome these inexplicable fears and bias. We also contribute to this systematic activity conducted by the Department of Health and international agencies. It is aimed at creating the legal base for schools, other educational institutions. It is aimed at education and work of people living with HIV. 10 years ago, alongside with the International Organization of Labor, we issued the first guidance for Europe and Eastern Asia. This guidance stipulated why we did not have to be afraid of these people. We had to support the students and the workers with HIV. And national guidelines are now based on these guidelines. And they are recommended by the Ministry of Health in 2017, when we created another kind of guidelines for schools related to non-discrimination and prevention of bullying at school. We adjusted our practical recommendations, and they were alleviated. They handled all the issues which might emerge in the leaders and the students and the workers of educational institutions. Precautions were put forth, and these guidelines were disseminated across the whole country. It is still used in many regions. We got the feedback from Altai Krai and Chelyabinsk region. In 2018-2019, we used these recommendations for teachers, for headmasters, 8 centers from the regions which you can see on the screen: Chelyabinsk region, Irkutsk region, Ekaterinburg, Volgograd region, to name a few. We reviewed these guidelines. It was a special document devised by the Scientific and Practical Center aimed at treating HIV in pregnant women, thanks to the support of Natalia Ladne, the AIDS Center, the representative Natalia Dementeva, and the Foundation of Strategic Initiatives. We managed to create this facilitated and handy guidelines for schools, colleges, institutions. People could understand how they had to act when teenagers or workers came to these institutions, if they are HIV infected. And if this fact is found out in educational institutions, these guidelines were recommended by the health department of the RF. And these guidelines comprise all the necessary pieces of information which are required by teachers, headmasters. There are answers to all the questions which students or parents may ask. Why is it safe when an HIV patient studies at school? How can HIV be transmitted? Why is it that important to comply with confidentiality? And how should people at school act if one of the patients or one of the students or one of the workers is diagnosed with HIV? How could they you communicate with the parents and the students in order to eliminate these fears? How could you respond to these questions, and how could you avoid these conflicts, providing the safety for all the workers and all the students in emergency situations? The precautions were reviewed, given the data stockpiled over these years. They were alleviated still. We can see the same data recommended for all the blood-transmitted infections. They're simple. They may be used at any school. There is no need in carrying out trainings. Still, neither teachers nor students should forget about it. People should not overreact and panic in these cases. The guidelines include a detailed algorithm of actions for different situations. If someone fights with other people, if someone has a bruise or a laceration, they also discussed how the first aid could be provided. Prevention of AIDS is topical for teachers, especially in the context of the schools where HIV patients are located. We selected special key points for their organizations for a short training for both children and teachers and parents. These guidelines were supported by the healthcare department. A brief webinar was organized all over the country. It is now widely used. It is also topical for AIDS center workers. It is a handy resource when they are invited to schools in order to carry out practical conversations or preventive conversations, or when some conflicts emerge. It is of universal nature. It may be downloaded on the website of our institution. You can see the link in the lower part of the screen, but the key problem, which I have already mentioned, is irrational fear. Sometimes they are inevitable, and these conversations do not impact the situation. It depends on the mastery and the skills of the teachers or the doctors who will be invited to schools. These doctors or teachers should tell others that HIV children are not dangerous for other school children. It's kind of arts, mastery of parents or teachers or doctors. And we also referred to cinematographic arts when we supported the creation of this film. This film tells the story of a girl with HIV. She studies at school and she faces bullying. This emotional impact on the viewers is also visible. And not all teachers and medical workers can contribute to it. This film was approved at many international festivals. You can watch it free of charge in the online cinema. Many kinds of media mentioned that it should be shown at all the schools, to all the teachers, to all the students, and it can also be used as a key tool of enlightenment and education. Let me show this bright image with our last product. It is aimed at helping teachers and communicating with young people online or at the audience, health, relations, love, and HIV infections may be discussed in the course of these conversations. And the Goodwill Ambassador of UNAIDS participated in these films, and they are now in English, in Russian, and they are placed on the educational website of Kyrgyzstan. They're aimed at all the countries of Eastern Europe and Central Asia, and this website may also be used when we face fear, discrimination, like when we lack attention, or when we would like to carry out preventive classes with students. That's what I would like to share with you. Thank you for the work done by public organizations. You really help the HIV patients, and we also contribute to it. And we would like to avoid discrimination and biased relations. Thank you very much.
Thank you, Tigran Albertovich. Thank you so much. Can you hear us? Can you hear us? If there are any questions, will he follow? Maybe you may write your question in the chat. Yeah, are there any? Please formulate them briefly. I can hear you only via broadcasting. Are there any questions? Thank you. Tigran, can you see us? Can you follow us? Thank you. Thank you so much. Okay, let's announce the next speaker. Taisheva Liliya, and she will be online with us via Zoom. Please switch on her presentation. Once again, thank you so much. Liliya, hello. Can you hear us? Liliya, can you hear us? We have, again, a communication problem. Maybe we... good afternoon, dear colleagues. I think you hear me, as I do not have any feedback. And unfortunately, I have to speak just one way. And if you hear me, I will get started. Good afternoon. My name is Liliya Taisheva. I'm the director of NGO organization, New Age. I am the doctor of medical science, the expert of the public chamber of the Russian Federation, the Agency for Strategic Initiatives. And my story today is about innovations in HIV prevention. When you may get a variety of results using several efforts, and organization of ours may support thousands and thousands of people and change the world. And we have to undergo some transformation since 2012. We have become an initiator for the prevention of HIV as a part of the great effort supported by the executive bodies, and HIV AIDS was a standalone program as well. And we've been cooperating with sports organizations all over the world. And when we organized our new event with the idea to prevent HIV/AIDS for the university, we didn't understand our clear mission. But in the midst of major events, we have quite a congregation of people in one area, and all the positive ideas had to be promoted. And this mass-scale event may also change the attitude of the society to HIV and socially responsible behavior. And thus we started organizing the series of very successful projects, thus opposing HIV. In the course of the summer university in Kazan, the aquatic sports championship, then 2017 events, the President's Cup, and the Secretary General of FIFA applauded our initiative. And when such person comes to your site and expresses his appreciation of your efforts, that's a real great praise and bonus to us. And in partnership with UNAIDS, with the federal and regional authorities, we got a very high evaluation of our involvement. And the Olympic Committee of the Russian Federation and other NGOs also spoke high of our work in the long run. Test for Victory, that's a brand new project which is organized by the Confederation in 2017, and it was a part of the large social initiative in Kazan when we had WorldSkills in Kazan to organize. And here you see some vivid exhibits as to how we were visited by VIPs and athletes and stars, but it is not a number one thing to mention, but our projects do change the mentality and track of thought of our people. And about 8,000 volunteers took part in that, and express tests were also mass scale. And we covered via our information media system the massive array of audience. It was about 6 million people altogether. Test for Victory. It means that you manage to struggle your fear, struggle other fears and deficiencies of yours. And the next project, Test for Victory, was supported by the presidential grant, and it has become a daily basis project. And we started operating at the Privolzhsk Federal Okrug and in 9 regions of the Russian Federation and 3 key locations like Almetievsk, Kazan, and all in the Republic of Tatarstan, and also Bugulma. And I guess that this project will definitely provide on a free of charge basis some prevention of various diseases, especially HIV/AIDS. And also Ombudsman for the Human Rights will also support our project accordingly. And the project is R&D based. And what we're seeing here is the table which says that 37%, 35, 17 was it was all the efficiency of our tests and we used all the available tools in order to implement this project for victory in terms of tests and other activities. We are supposed to involve 60,000 people, plus express tests for HIV. And we started providing all these available services for the general audience. And the tester mobile is traveling all along the regions on a daily basis. And we used to think that we would be testing people more in the major cities and towns. But once we come to rural areas and other small-sized settlements, I see that those tests are in a very high demand. And this is a statistics of today, and for us it's a very valuable experience. What is the peculiarity of the project? And the Ombudsman for the Human Rights supports us in providing the full scale of services on a full cycle basis. And thus we address all the challenges of today, and up to the problem is revealed, and up to the problem is resolved, we support the entire process. And really, we're going to work with the social network, with social media, and the various venues and sites. And it will be, for example, the charitable program in VKontakte, and thus covering quite a number of people. That's the largest project in Russia as to the human rights exercise. And when the Presidential Grants Fund was originated in 2018, we used to say that large-scale projects are necessitated and the major companies are to be involved in that projects. But as of today, we do realize that our organization may be given grants of various types, and St. Petersburg also has another interesting project based on this system of grants. And definitely, I really have to comment on that slide. And we have the socially responsible organizations to deal with HIV and AIDS, and it couldn't be done without the team which we have, and it's 24/7 program work, and actually they managed to cover 7,000 kilometers, covering 600 locations, and nobody said no to that particular initiative. And program director, Mrs. Burenkova, Gulnara Fizyanikova, so these are very promising people, and you may put a question to them. And my team has their own stories. They actually arrived as volunteers. Now they work as coordinators. And actually, they teach other people to learn.
Invariably, our experience shows that our resources and the potential of the partners are beneficial for us. When NGOs and the representatives of show business and famous sportsmen unite, we receive this synergetic effect when we change our attitude to it. And there is one illustrative example when we started working on public testing, and the representatives of the media came here. People were reluctant to comment on it when there were some queues for the test. And now people are eager to make the videos of them in the rear projection, and no one of these people were eager to hide their faces because it is okay to undergo tests. In conclusion, let me show the following issue. For the strategy on prevention of the spread of HIV infection in Russia, this document plays a great role in the civil society. This year demonstrated us that Rospotrebnadzor and the President of Russia supported the role of the civil society at the regional and federal levels. Many NGOs face misunderstanding or even prevention to their work. When the head of the Gene Epidemiology Center says that he's not aware of the fact that they're doing special work on HIV prevention, some resources of healthcare were also modified. The programs of supporting voluntary groups did not have any regional funding, thus they suffered. We're interested in the territorial structure of Rospotrebnadzor, and reports are provided. There is no real support and assistance. Another example is the following. Last year, we worked with more than 4,000 people from vulnerable groups of people, and only 63 people of them were HIV positive. And healthcare institutions helped them. Our case is not single nowadays. As far as I know, the situation in other regions is not much better. And NGOs are not the field of interest for everyone. Not each AIDS center is interested in NGO, and not all these centers cooperate with NGOs for many years. It is a little bit strange that our project was supported by about their activity. Thank you, and sorry for being so emotional. And to sum up, let me highlight that our health is our top priority. Being a medical doctor, I would like to tell you that the scenario of the HIV infection is similar to the scenario of COVID-19, but it is more prolonged. And the name of our team, Task to Win, is symbolic. Hopefully this year we will be able to combat HIV and COVID-19. Thank you for your attention. Here you can see my contact data and my email. You may send me a message because I cannot hear the questions. The audience, there are still 2 workers who may answer these questions. Thank you. Thank you, Liliya Akatova. Thank you for your gorgeous presentation. Still, you cannot hear us, can you? If you have some questions, you may ask them, and our colleagues will be able to answer them. We may put them forth in the end, and then we will tackle these issues. There are also some brochures, some leaflets, which contain the key information. We can only hear you via the broadcast. You may just take these brochures, the key information. There are also our bracelets. Any questions? No questions. Now, let us address Alexandr Mordovin from Moldova. He will represent the initiative of the International Federation of the Communities of the Red Cross and the Red Crescents. He will draw upon solving the problem of equal access to health care in the context of HIV infection for the most vulnerable groups of the population. Neither will he hear us. Could you please start it? Yes, I will dwell upon it right now.
Добрый день.
Good afternoon, dear colleagues. I hope that you can hear me. Can you hear me? Yes, we can hear you. Okay, now let me start. I can also hear myself in the broadcast. Dear colleagues, good afternoon. First and foremost, let me introduce myself. I am the vice head of the regional representation of the International Federation of the Society of Red Cross and Red Crescent in Russia, Belarus, and Moldova. Let me outline the activity of my organization, but you should know that the International Federation of the Red Cross and the Red Crescent is the largest humanitarian organization in the world. It operates in over 190 countries of the world, and it unites the societies of the Red Cross and the Red Crescent. We have been mobilizing the communities for over 100 years. Thanks to our activity, we protect people who are outside the social system. We also provide psychological support and social support, and our organization has sufficient potential for tackling healthcare problems in acute situations, and we also increase the feasibility of and the vital aspects of those who are combating the HIV infection. We also dwell upon social protection. This experience may be beneficial for expediting the events of HIV prevention. We need it in order to combat the HIV and AIDS epidemic in 2030. The community of the Red Cross and the Red Crescent is vital in our region. We raise awareness of the migrants, and we provide them with access to healthcare services, and the vulnerable categories of this population can also participate in it. And let me dwell upon this issue. Maybe my presentation will not be in line with the practical context, but our work and our key topic mean the contribution to our activity. Hopefully the people who need help will get it, and the representatives of the civil society working with the people in need will also benefit from it. It has already been mentioned at the conference that our region, EECA, gives the highest speed of HIV spread in the region. epidemiological processes impact one another, and sometimes the legal basis is not agreed upon, and countries combat the HIV epidemic in isolation. Thus, it affects new groups of the society. When we solve these comprehensive issues related to HIV infection, we still have lots of barriers, such as medical, social, educational barriers, while combating the infections. The hurdles are the following: stigmatization and discrimination. Well, and this barrier exists when people are tested for HIV. Sometimes people are not granted access to it. The access to treatment is insufficient. In some CIS countries, only 50% of people receive the adequate ARVT and the corresponding medical care. Thus, the interruption of treatment or absence of drugs may deteriorate someone's health, and it may also negatively impact the HIV epidemic with certain consequences. It is an important factor of combating the HIV, especially in the countries with labor migrants. When treatment is provided to HIV patients in these countries, the following question arises. This norm aimed at these people should be included. I mean, the norm, which is not that epidemiologically efficient and effective, but it is a barrier. People with HIV should have the right to be in other countries, and it unfortunately contributes to stigmatization of migrants. The key barriers to organizing the treatment and expanding the access to healthcare are the following. There are some legal barriers in these countries, and there is also a problem of financial support of HIV patients in other countries. This problem has various aspects, and we need a comprehensive approach in order to solve it. It should be aimed at mobilization of efforts of state agencies and organization of the civil society. One of these examples is reviewing the legal basis of the international organizations and the organizations of the civil societies and the public organizations. The review should be prepared for the legal basis in the countries with these patients. It was conducted by the Red Cross and the Red Crescents jointly with the International Assembly of CIS countries. We take into account the mobility of the population, and there is no aspect which will be a review of the legal basis in the region. And these measures were topical. This document allowed us to provide the full-scale patterns of the legislation of in the CIS countries, the accessibility to comprehensive support should be provided in these countries. This review became a prerequisite for developing so-called special laws for CIS countries aimed at equal access to the services aimed at prevention of and the treatment of HIV in the CIS countries. We have analyzed the legislation and the coordinated efforts of the countries aimed at combating CIS, and joint control may increase the effectiveness of our actions aimed at providing access to treatment. This would allow us to control and to forecast the consequences of the epidemic in these countries, and this would decline the mortality associated with HIV, as well as the morbidity. this legal basis would allow us to find optimal political solutions, and it will be based on the legislation of the CIS countries. And this would allow us to effectuate the effective to the programs aimed at combating the epidemic. The chance to providing medical assistance to all the categories of the population in the CIS should be notched up in the legislation. In 2019, we initiated the following aspect. The International Assembly of the CIS countries decided to devise this law aimed at combating HIV epidemic and equal access to diagnosis of HIV and AIDS in the CIS countries. This initiative was approved in the beginning. People started initiating this project in 2019. Still, we understood that we were a large international agency. Still, we were not able to introduce these legal initiatives without the participation of the representatives of the civil society. A key stage while drafting this legal draft became the forum of the representatives of the civil society in the CIS countries. It took place in 2019 in November in Moscow. Over 20 agencies of 20 countries were involved in it. And I also mean the community of the Red Cross and the Red Crescents. There were also some service organizations and the special organizations aimed working in these countries. The Oganes, the facilitator, you also participated in this event. We formulated the key principles during this meeting, as well as the key approaches and the key barriers. And we have to eradicate these barriers by means of the new law. Eventually, the legal draft was devised. Regrettably, the process of enacting this law is time-consuming. Still, in November 2020, we managed to firstly listen to this law in the Interparliamentary Assembly of the CIS countries, and then it was sent to the parliaments of the CIS countries in order so that they could amend it or listen to some comments. The key aim of devising this law is harmonization of the national legislation of the CIS countries, providing equal access to HIV prevention and treatment. This law would rest on following the rights of the citizens in the CIS countries, in the
and the public guarantees. And the priority is that the patient may be provided with the social and medical aid in case they experience a loss of health. Also, the responsibility of the executive bodies for the safety and medical care, the quality of it, the responsibility not to deny any person, and failure to comply with the medical secret. And as I've mentioned already, within three months, we managed to approve it after the first hearing at the Standing Commission on the Human Rights. And from December to March, this bill has to undergo some expert review from the CIS Parliament. So we got the comments from everybody, and the majority were quite positive as to that bill's contents. And tomorrow The Standing Commission on the Social Issues and Human Rights is going to have the second hearing of that draft law. And I do hope that it will be successful and approved further. And afterwards, we will get it prepared for its adoption at the autumn session for CIS countries. If the law is approved by the interparliamentary group, will not be subject to the 100% approval by the CIS countries, but proceeding from the fact that it has underwent certain hearings at the national parliaments and line ministries and agencies of all the CIS countries, we do suppose that this law will give us a very high level of adequacy. And I do mean that we're supposed to have the promotion for the Red Cross and Red Crescent, and those who oppose HIV infection, and that is a new instrument which will be aptly used by us in promoting the advocacy and political dialogue at the level of all decision makers in both countries and in various countries, and thus we may amend various national CIS laws. And those harmonizing them and making them more efficient, attaining the goals of the global strategy for HIV. Thank you very much for your kind attention, and if there are any questions, I'll be more than happy to answer them. Thank you. Thank you, Alexander Stanislavovich. Yes, are there any questions from the audience? I can't hear the audience. Sorry to say that. Not so far, and I would like to request that the organizers would write a few words of gratitude to everybody. Thank you, Alexandr. Thank you. Thank you. Dear colleagues, we followed quite a number of presentations dedicated to the topicality of PPP and communications with NGO. And we know much about stigma and discrimination and how to oppose it. We heard about various attitudes as how to improve the access to HIV treatment. And I think this session gave us some new impetus, some new ideas as how to work further. And thus we will really bear fruit and find something beneficial for us all. Thank you once again for your kind attention.